Hi everybody, my name is Dr. Ryan Howard. I'm a second year resident at the AEODO orthodontic residency here in Henderson, Nevada. My research is on the efficacy of temporary anchorage devices in skeletal open bite correction, and it's a scoping review. So introduction, there are people with these things called skeletal open bites, where their upper and lower teeth, when they bite down, are separated from each other. And so basically the premise of my research is analyzing the literature with regards to how we treat these skeletal open bites. Pretty much, if you're not familiar with orthodontics and this kind of crazy new advance that we've had, is there's these little mini implants or temporary anchorage device which actually gets inserted into the bone, and since it's in the bone you can use it to pull on things and actually move teeth. And so for skeletal open bite patients where their front teeth are separated like this, like if here's your upper teeth and your lower teeth, right, they're separated like this, what you can do is you can place one of these temporary anchorage devices or multiple in the back, and you can actually pull from it the posterior teeth up, and then as the posterior teeth kind of intrude or go upward, then the open bite kind of closes down and you can correct these skeletal open bites. So with regard to the research, we looked at temporary anchorage devices. There's a couple of different fashions in which they're used. One is just the screw, just an actual screw where it's just inserted straight into the bone. There's these other things called mini plates. And mini plates, what they are is they're basically these eyelets that are connected. And you can kind of look here in the upper left in this picture right here. There's these eyelets that are connected to each other, in which these temporary anchorage devices are then inserted into, and then the whole thing is used to kind of anchor and they pull from them. So it's kind of analyzing the difference between mini plates and mini screws in the research, and see if there's more effective approaches, or if they all work, or if mini plates are better than mini screws is kind of the idea here. So throughout the research, what we did is we followed the Prisma SCR guidelines to gather different articles to pull from. We found 837 initial articles and whittled that down using our criteria to 30 cases. We looked at things like we want to have more than 10 patients studied, not case reports, that kind of thing. And what we concluded overall is that it's very predictable and very successful in all cases. The skeletal open bite either closed a little bit or closed completely, but definitely improved in every case. There was lots of different designs. Sometimes there was banded, second molars through the premolars were all banded as one unit. Sometimes they had bite blocks in the back. Bite blocks actually made it a little bit more effective, but they all worked. There's many different designs that are available, and the one interesting thing that we found was that the mini plates versus mini implants actually were a little bit better in the first molar intrusion, but not by too much. And then the treatment times were pretty comparable between the two. And so pretty much, long story short, whether you use a mini plate or use a mini screw, they're both great options to correct skeletal open bites. And no longer do we only have the option of surgery to close these skeletal open bites. There's different things that we can do.